The United States could soon have two highly effective COVID-19 vaccines. Already, hospitals around the country are working to distribute thousands of doses of Pfizer's COVID-19 vaccine to healthcare workers. It is a start. Much more work to do. FDA documents released today show Moderna's COVID-19 vaccine is 94% effective. That makes it likely the FDA will approve emergency use later this week. If all goes well, the top scientist behind Operation Warp Speed says 20 million Americans could be vaccinated by the end of the year. Metro Atlanta hospitals are still waiting to receive their first doses of the Pfizer vaccine, with the first Georgia shipment going to workers along the coast. 11 Alive's Palacuro explains why.
Rounds of applause as Savannah healthcare workers received their first doses of the Pfizer coronavirus vaccine. Here at the Coastal Health District, where a shipment of almost 6,000 vaccines first arrived Monday. That's a decision Governor Brian Kemp says was made by federal partners.
The way the vaccine is shipped, obviously you could think about the logistics. When they're shipping it from the manufacturer, they're not just thinking Georgia. I'm sure they're thinking, where's the flight going to hit if it's coming by flight? Where's the truck going?
The Department of Health says vaccines will make their way to Metro Atlanta Wednesday, reaching hospitals and providers by the end of this week. Health Commissioner Dr. Kathleen Toomey says Georgia will initially receive 84,000 more doses. The shipments will head to facilities with freezers to keep the Pfizer vaccine at its required -70°C. Dr. Toomey says a lot of rural hospitals won't have that kind of storage, so many are waiting for Moderna's vaccine, which could be authorized by the FDA by the end of this week and doesn't have to be kept as cold.
So many of the rural hospitals, as well as our rural health departments, have chosen to wait a week or so for the Moderna vaccine. And I expect us to get around 174,000 doses of that vaccine. And that doesn't require that super deep cold freezer. So that will be a lot easier to transport.
According to this NBC map, 4 out of 5 Americans live within 5 miles of a pharmacy that will be part of the federal vaccine allocation, with those areas shown here in blue and areas with zero access within 5 miles shown in red. In Georgia, in Cobb, Fulton, DeKalb, Gwinnett, and surrounding counties, at least 99% of residents live within 5 miles of a participating pharmacy, while 0 to 1% of residents in rural counties like Tolliver and Warren live within 5 miles of a pharmacy, which means they'll have to drive further and access could be more limited.
So the only limitation is the production of the vaccine, which has been slowed somewhat in December, but will be accelerating again.
Right now, there's a high demand and short supply of vaccines. So once they reach hospitals, how do the hospitals plan to prioritize which healthcare workers get it first? That story coming up at 6.